Hi there, talking to you about genetics again, and today I am going to talk about what you should be looking for in a practitioner who orders this test, interprets this test, and guides you through what to do with your nutrigenomics results, as well as some red flags about labs, languaging that people use, etc. And as always, to remind you, especially if you're new, I've been in the genetics field for 15 plus years. I have an undergrad degree in biochemistry and a graduate degree in medical genetics and genetic counseling, and I worked as a genetic counselor for 13 years combined at UCLA and two other private institutions. I did multiple research studies. I've been published so many times in peer-reviewed journals. I worked in a clinical diagnostic laboratory for many years, so I know a lot about what goes into lab testing and what to look for especially. So basically, I am an expert in genetics and in this field, and feel very confident in the service that I provide. And it pains me a little bit that there are people out there using this testing in an inappropriate way and really doing patients a disservice. And so two things I really want to hit on is what your practitioner should be able to give you from this testing, and two, what laboratory or laboratories they should be using, and most importantly, what shouldn't they be using and why. So let me first start there. There are very few labs that know how to do nutrigenomics testing. There are a lot of direct-to-consumer companies out there, meaning you can order tests on your own. They give you results and you take them to a provider for interpretation. The lab I use, you can order the tests on your own. I'm happy to talk to you about it beforehand. But I also do an in-depth review when the test results come back. The problem with a lot of direct-to-consumer lab testing is there's a lot of fine print, and they assume that you're reading it, and they don't really have the best integrity in keeping your DNA results private. And so what that means is many of these companies, particularly 23andMe, sell your genetic data to big pharma, to insurance companies, to places like Google, and there's not a whole lot of privacy around your DNA. Meanwhile, in the clinical genetic world, there are tons of laws around privacy, keeping these results to yourself. This is your blueprint of a lot of your DNA. So you want to be working with a lab that has privacy, one. Two, is only running DNA for what they're telling you they're going to do, and they're not having raw data that patients can get a hold of and run through a software. Because here's the thing, a lot of times they're looking at things that aren't advertised on their website, and it could be things that really need serious medical intervention, kind of like the breast cancer genes. 23andMe and a lot of hot water around reporting that out without having proper genetic and scientific interpretation. So when you're using raw data, it's not interpreted by a scientist. It's just run through a program, and oftentimes because it's uninterpreted, the results don't mean what someone is telling you. So you want to make sure you're working with a qualified lab that's at the bare minimum CLIA and CAP certified and has privacy and is only running what they tell you. You should not be using raw data, your uninterpreted data, and just running it through a system, because guess what? You're also giving that entity full access to your private DNA information. So just a warning, make sure you are working with a provider that knows about these things and can articulate them to you. And that is up to you if you choose to do that. If you don't think it's a big deal to have your DNA in a cloud somewhere and shared with whoever, more power to you, but most people really want their genetic information kept private. Which leads me to my next point. You also want to work with a provider that's been trained in genetics, because if they've been trained in the genetic system, if they're trained in ethics, They're going to know about all of this stuff. It's part of their consent process when you're doing any testing with them. It's on their website, etc. If someone's not trained in clinical genetics, you're not going to get much out of your testing. You're not going to get much in the way of interpretation, actionable results. And sometimes when people aren't trained, especially on the psychology and ethical end, patients can report anxiety, having like a negative experience with genetic testing, a lot more things that are more severe, but I won't go into. And I've seen this over the course of many years in practice. People who aren't clinicians. So when I say clinicians, I mean seeing patients, trained to see patients, have empathy, have bedside manner, know how to talk to people, can be really gentle with how they present information. That's what you want when you're getting genetic testing results. You just don't want someone telling you you have bad genes, you're a mutant, something's wrong with you. That's not what this is about. This is actually really empowering information. Everyone has genetic differences. Everyone has some genetic weaknesses they're born with. That's just how we're made. That's why we're unique. And luckily, there's ways to counteract this through diet, lifestyle, exercise, sometimes supplements. So it's actually really empowering information. So you want to make sure it's being presented in that way to you. It's comprehensive and it's private. I liken this to like something like an astrology reading or a human design. Someone who has all of this genetic information for you can really see a lot about you, can give you a lot of guidance on how to live your best life and optimize your health. So you really want to be able to trust that person, and trust that they have your best interest in mind and they're not just like very science minded and just giving you data, because that's not really helpful. You need an explanation, you need guidance to make a lot of these lifestyle changes and understand really how to get a hold of your health. The other thing I'll touch on is testing children ethically. Not really considered in medical genetics, probably not in nutrigenomics either, unless there's a lot of symptoms or real reason to test children. Reason being, kids cannot provide their own consent. The parents do it for them, and so I'm not saying kids could never be tested. There's definitely instances where it makes sense and is appropriate, but you really need someone with that ethical compass to make that decision, to know the guidelines of when it's appropriate and when it's not. And especially if you're sending it to these labs like 23andMe and Ancestry, you don't want your kids' data going to Google and all of these other places. Who knows how that will affect them in the future. So just some things to look out for in a practitioner. There's not that many people that are trained in genetics. There's not that many people trained in nutrigenomics. There's not that many labs that specifically do nutrigenomics and know how to interpret these results and are up on the current research. So choose your provider wisely. Please, I beg you, do not use 23andMe. Do not use your raw data. I mean, unless you're comfortable with having incomplete results and it not being private. I don't think you want your DNA just out there. So I'll wrap it up. Any questions, I'm happy to take them. I love educating people on this. There is really a lack of understanding about genetics and nutrigenomics and all the intricacies that go with it, but it's nothing to be scared of. When you're with the right person and provider, it can be really empowering and you can learn a ton about yourself and really how to live your best, your most healthiest life.